Hi everyone, and welcome to the 7th lesson of the Health and Wellness for Older Adults course. I'm actually really sorry that I used this background. It's just so bright. Anyway, today in lesson 7, we are going to be looking at mental health and mental health disorders. So let's go ahead and dive right into that. So first of all, what is mental health? Mental health is the ability to engage in productive activities. Mental health varies throughout your life cycle, and one evolving task of old age is acceptance. Okay, and just acceptance of everything that is and life as it is and how it has been and the life that you've lived and all of that. So cognition. All right, so most aspects of intelligence will decline with age, unfortunately. And it's not, I don't necessarily mean the knowledge that you have acquired over your lifetime, but we're talking about the ability for you to learn new things, new tasks, new knowledge, to acquire new knowledge, and also the ability to perform motor skills like just moving around and things like that. That will decline with age. But experience and things like that that you have been able to gather, hopefully that will actually kind of compensate with the amount of intelligence that you're that is declining from you. So how can we try to retain as much intelligence and, the ability to learn tasks and to be able to move around with great motor skills and all that? One thing that can be done could be using puzzles, crossword puzzles, things that really engage the mind and strengthen those neurological pathways in the brain. Okay, so if we can try to strengthen all those neurological pathways in the brain, you do have a higher chance, or it is more likely that you will retain some of the ability to do new things and things like that. Cognitive losses are accelerated with depression, also surgery, things like that. So also another way to be able to retain knowledge or retain intelligence and whatnot would be to try to keep your spirits up. Okay, so you'll reduce the amount of cognitive loss that you'll have in the future by just enjoying your life, okay? Not allowing yourself to fall into a depression. Try to keep your mental state more healthy. Okay, psychological changes. So there are some psychological changes that happen to older adults. Okay, so first let's look at memory loss. So memory loss can be quite common among older adults. This is when they might start performing really poorly on memory tasks that require speed, memory tasks that require a lot of focused attention. So in these cases, mostly what is affected is their episodic memory, like their short-term memory, right? And often memory lapses are what's happening. And these memory lapses that are occurring in older adults are going to be caused by anxiety, lack of sleep, and a big one, drug side effects. Okay. As you probably recall, a lot of these older adults are on various different medications for their chronic illnesses, and as all medications will have side effects, and memory loss is actually a very common side effect on many of these medications. Okay, so then let's look at personality change. So personality traits, a person throughout their lifetime is going to have various different traits that may evolve over time, But usually a person's personality, these are like your group of the traits that you have that have been consistent over time, and pretty much it's going to be remain the same. So older adults over time, they usually have developed a better coping mechanisms with change. Okay, so you'll see many older adults who just sort of mellow out at this point, and you might see that in their personality now, because they're dealing with huge changes, and many of them are just gonna take it, accept it, and they're gonna have more mellow personalities. Whereas maybe when they're a lot younger, they could have been more strict and more stern and like, everything has to be like this. But over time, then they're just kind of like, you know what, this is life, and they'll roll with the changes. So anyway, now let's look at mood disorders. First of all, we're gonna look at depression. So depression, criteria for depression or clinical depression is much more different than just feeling sad. Okay, major depression is actually the leading cause of disability in the United States. Okay. Treatment of depression can include therapy and medications, like antipsychotic medications, antidepressants, things like that. Older adults who do have depression are actually at greater risk for suicide. Next, we have anxiety. Types of anxiety disorders that you may be dealing with will be panic disorder, obsessive compulsive disorder, anxiety disorder due to general medical condition. It's difficult to diagnose anxiety usually because it might come with the presence of other illnesses. So there might be other psychological disorders, okay? Or this could also be a result of medication, okay? A side effect of medication. But anyway, so usually the treatment for anxiety is either going to be therapy or medication. So you're going to be taking like antidepressants and antipsychotic medication. Next, we have psychotic disorders. Okay, so psychosis is the inability to distinguish what is real from what is not. So this can include having delusions, having paranoia, being afraid that people are out to get you, and all that, and also hallucinations. So you might see things that aren't actually there, or you could be hearing things that aren't actually there. Okay, then there's schizophrenia. Schizophrenia is a very common type of psychosis. Usually people who have schizophrenia are going to get it from a young age. Okay, there really aren't any cures for psychosis, for schizophrenia or psychosis, but there are medications to kind of help the symptoms. Then we have sleep disorders. There are more than 100 known sleep disorders. Okay, so sleep disorders can be short-term or they can be chronic. Okay, sleep disorders are very, very common and they affect about 1/3 of us. Okay, so disorders are due to age-related changes in sleep patterns. Older adults tend to be very high users of sleeping pills, okay, which usually creates dependency. So it doesn't necessarily always help the situation, but at least they can sleep. Restless leg syndrome and sleep apnea are different types of sleep disorders. Then we have substance abuse disorders. Okay, so substance abuse is the the use of a substance despite having negative and social consequences. This includes, you can abuse a lot of things, really. You can abuse alcohol, tobacco, illegal drugs, prescription drugs. You can, painkillers, sedatives, antipsychotics, things like that, right? So substance abuse disorders can be difficult to diagnose. Many older adults do not have bosses or even spouses to detect the problem. Okay, usually it's the people who are closest to the individual, and the ones who kind of work directly with them. But if there is no one there, then it's really difficult to even detect that problem, detect that someone has an issue. So many older adults are not usually they're usually not disruptive socially either. So if they do have this kind of problem, it's probably going to be very quiet. They're going to be very discreet. You're not even going to notice too much in their behavior. Okay. Then there's nicotine dependence. So smoking is the #1 cause of premature death. And I know we've said this before. Cigarette smoke is the #1 cause of premature death and disability in the United States. Physicians should continue to encourage older adults to quit smoking, although sometimes, at a certain point, it's like, what's it really going to do? But anyway, that's kind of like an attitude that many older adults have at a certain point. But there are drug programs and non-smoking programs that are actually out there and can help older adults quit, because of course it doesn't really matter when you quit. Whenever you do, it will help your health, your overall health and wellness. It will it's going to help your circulation and things like that. And of course, if you're an older adult, you're more susceptible to a lot of other health problems if your circulation is not on point. Okay, so cognitive disorders. Let's look at dementia and Alzheimer's. So dementia is progressive brain impairment that interferes with memory and normal functioning. Okay, Alzheimer's is the most common multi-infarct dementia, which is a series of small strokes. This increases with advancing age, and some dementias are reversible, many are not. Symptoms for both dementia and Alzheimer's will include losing your memory, also language, and losing the ability to care for yourself. And so dementia, still on dementia and Alzheimer's, sundowning is a worsening symptom symptoms in the evening hours. So during evening time, your symptoms actually get worse. Evening hours, okay, sundowning. Diagnosing dementia may take a lot of time. Okay, it can take a while to even get a diagnosis. It's often quite difficult to actually pinpoint what is going on with the individual, if it's dementia or Alzheimer's, or it could be something else. It could be a side effect of medication and things like that. So no one knows the cause of Alzheimer's. Okay, that has not been found yet. Alzheimer's and dementias are deadly, both of them. Age is the greatest risk factor for having dementia. Okay, so treatment for dementia and Alzheimer's would be having family support, like a good, strong support system, And then there are drugs out there, the medications out there that do help a lot of the symptoms. And then, of course, there's therapy. Okay. So next, we're going to look at transitions later in life. So many transitions are characterized by loss. Okay, many transitions that you're going through as an older adult. So that includes physical loss, psychological losses, social losses, economic losses, and interpersonal losses. Other transitions that you go through later on or throughout life can be quite joyful, such as watching grandchildren grow, having more leisure time, being able to travel if you can, things like that. Okay, so transitions. Now we're going to look at transitions. First up is retirement. So retirement is the beginning of a life of leisure for many, or it could be seen as the loss of income. Okay, it could be either or depending on the individual. That's how you look at it, right? Social Security and Medicare do somewhat help a little bit with financial loss, but unfortunately, retirement, having that loss of income, Medicare and Social Security are not going to match, probably not going to match the income that you did have with your actual job. So that's why it's always great to have invested already or have money saved, be part of a 401k or having a pension. Things like that do help in old age to help supplement your loss of income, because Social Security and Medicare are not going to give you the life or the comfort that you will actually require more in old age than while you're young. So unfortunately, retirement is actually hardest on single women, okay, and minorities who may not have pensions or did not pay into Social Security when they were younger. So next, the next transition, we're going to be looking at relationships and children and grandchildren. Okay, usually older adults derive much of their strength and their support from their adult children. At a certain point, their adult children kind of become the parent, if you will. They're going to start making more decisions for their parents and helping them, in this transition and becoming their support and, maybe fulfilling larger roles in their parents' life at this point. So the roles can kind of be reversed a little bit, and the kids become the parents become the kids, things like that. And then many grandparents out there actually raise or care for their grandchildren. In a lot of family situations, the grandparents become like the surrogate parents, as maybe the parents of their grandchildren could have passed away, or maybe they might be single parents, so they have to work, and they might have to work, long distances or things like that for their job, and so they'll have, their parents or the grandparents, take care of the kids. There may be other unfortunate family situations where there is no parent present. They may be doing whatever, and so the grandparents raise the children. Next transition will be marital transitions. Okay, so first, let's look at adjustments to divorce or widowhood and remarriage can all be experienced in the later years. Many people probably wouldn't think that older people get remarried, older adults get remarried, but that does happen quite a bit because people like to have that companionship And it helps so much with your health and well-being in older age. This is another huge transition that many people still experience. Of course, widowhood is quite common, especially for women, because women tend to outlive the men in older age, but also older adults do get divorced as well. So anyway, let's look at the illness of a spouse. So illness of a spouse, especially in old age, can be a bit more serious, and that's going to be a huge transition, and can also prompt many changes in the married couple's life. Often that can be quite negative, okay, because that would make one of the partners will be dependent completely on the other. So although usually there's a lot of understanding and whatnot, it still puts a lot of stress on both of them, and it could cause a lot of stress in the marriage. Okay, and then there's the transition to widowhood. This has many changes. Okay, so there's going to be the financial situation, of course. So now you don't have that other income. Then there's your living situation. Are you still living in your same space? Because if you are, you're going to still have that memories of your spouse all over. Friendships might change, okay? And then your sexual relationships might change as well, and your habits there. So it's a big change. Now let's look at solutions or psychological treatments for a lot of these. So psychotherapy is a good treatment for most disorders. The treatment of mental disorder by psychological rather than medical means. So experts believe that therapy with older adults should be brief and focus on problem solving. Okay. And most of the interventions or the different treatments that would be done might be having group therapy. Then there's artwork, doing something creative, and there's walking Zumba or just doing some sort of physical activity as well. Peer counselors are also very beneficial. Peer counselors are not necessarily licensed psychologists. They can be friends and whatnot, but this can be very beneficial because usually many times when we have a lot of things going on, it's just very, very cathartic to get it all out and then have someone just advise you or comfort you, support you in some way. So next we're going to look at mental health services. The first one we're going to look at is nursing homes. So nursing homes are a very common place for mentally ill older adults. But these homes may not always be completely set up well for mentally ill patients. Some states out there actually do require more dementia training for nursing home personnel in these homes because, many of them just aren't trained well enough to handle dementia, Alzheimer's, and other patients who have those type of mentally ill disorders. There are actually some nursing homes are specialized and are specialized to care for dementia and Alzheimer's patients, so those are more likely to provide better services for the older adults compared to just your standard nursing home. Okay, so anyway, a major advantage actually of nursing homes is that you have 24/7 care. Okay, so next, here is just sort of a list of different mental health services that are available. We have public mental institutions. and then there are psychiatric units in hospitals. Okay, so when it's a public mental institution, this of course is going to be government owned. Anytime it says public, it's owned by the government. Okay, and most public mental institutions are actually owned by the state government. So usually these are going to be state. I'm just going to put that out there so you guys all know. State owned. So this is going to be publicly funded. So anyway, 1 out of 3 patients in a mental institution, a public mental institution, is an older adult. Most have schizophrenia. They could suffer from like alcohol abuse or even depression. Many have been there since their early adult years, so they've been there for a while, for a lot of their life. Then we have psychiatric units in hospitals. So this is when the hospital has its own psychiatric unit or a department, a section of the hospital specifically for psychiatric patients. So primary providers, this is usually for a lot of acute mental problems. Okay, hospitals offer a high staff to patient ratio, and it's close to home treatment. So they have like a good handle or control on to the patients in these psychiatric units in hospitals. They're not necessarily designed for like chronic illnesses. Okay, so they're not going to have a lot of counseling and therapy in these type of units compared to the public mental institutions, because they are actually focused on these are more for chronic illnesses, right? If you're having a acute mental problem, you're having some sort of flare-up or panic attack or something like that, that's more for what a psychiatric unit in a hospital is for. Okay, so now look at community mental health centers. So these centers offer 5 basic mental health services. First, there is inpatient and outpatient care. Inpatient care is when you are admitted and you stay overnight in this health center, and then there's outpatient care where you are just you get your treatment and then you go. Okay, they also offer 24-hour emergency services, also partial hospitalization, consultation, and education. These centers are publicly funded with sliding scale costs for services, and most of these different types of centers do not necessarily meet the needs of older adults. Okay, a lot of these centers are actually more for people who are of a younger age, and many times this is for emergencies. You can become a usual patient and where you can get help regularly for a chronic illness and whatnot, but for most part, when they do get flooded, or depending on where you are, they get these different centers, they get a lot of people coming in, and if they do get a lot of people coming in, they may not be providing the best care. They may, especially if you just have a chronic mental illness and you're not necessarily having any kind of flare-up or any sort of like emergency situation, okay? But if you are more panicky, they'll focus more on you in that way. Okay, so now we're gonna look at mental health services. So we got case management services and then protection and advocacy. Okay, so case management services. These are case managers that are out there, and you can go see them, show them every ability to pay that you have, what insurance provider you have, if you have money, what do you got? And then these case managers will say, okay, these are all the different local services that accept your insurance or whatever way to pay you have. Okay, so they can kind of match you up with whatever you need, whatever mental health services that you require. They usually will try to delay institutionalization. Institutionalization is very expensive. Okay, so that's what you want to go to at more of a last resort. You don't necessarily want to jump there and spend a ton of money. Okay, and then there are limited resources, of course, as well. So we don't necessarily want to just spend all this if it may or may not be necessary. And that's usually why they want to sort of delay institutionalization. Also, institutionalization, you could stay there. I mean, many times that's what happens. You might stay there too long. You don't want to go down that road, really. So if you can maintain function and still live your normal life while receiving therapy, it's probably a better idea. Protection and advocacy. A lot of older adults, mentally ill older adults, are very vulnerable to abuse. So it is very important that the states protect the older adult patients. All right, so reimbursement for mental health care. So Medicare works a lot like private insurance. Okay, first of all, Medicare is not free. The government pays for a large portion of the insurance, but then at the same time, there are a ton of out-of-pocket costs and additional things that you have to pay. Unless you are a dual beneficiary and you also receive Medicaid, then usually Medicaid takes care of these out-of-pocket costs. So anyway, Medicare Part A typically will cover your acute psychiatric hospitalization, and really any kind of hospitalization. They will cover your hospitalization in a psychiatric hospital as well, up to 190 days. Now, Medicare Part B will help cover costs for your inpatient medical health services and then your mental health services, your outpatient mental health services, and then, but they'll only cover so much. Okay, so there will be an $1,100 cap per year on mental health services, which isn't that much, which means you will be paying anything after that. So why do older adults not use mental health services? Well, first of all, we got those beliefs. It may stem from our belief systems. So it may be really difficult for older adults to admit that they need help. It's actually kind of difficult for a lot of people. So many people, it's very common for people to just not really want to admit that you need help. Okay? And so, this may actually attribute to symptoms of illness or age. So, and then there are professional biases. So there could be maybe people out there might be like, nah, you can't teach an old dog new tricks. You can't teach an old person to start new habits, new mental health habits and things like that. They're not going to do anything, so it's a lost cause. Then there are system barriers. So Medicare, first of all, does not cover enough of the expenses for a lot of these mental health services. Dementia is often excluded from, completely excluded from a lot of the payment for these services. And then also often there are not enough doctors in the community that are trained in mental health for older adults. Okay. So what can we do? So what is being done? Okay, there are reformations that happen in every era that help us as a country and as a healthcare system move towards building a stronger mental health system. Okay, so right now we have drugs or medications have become easier to take with less side effects. Okay, so we do have better drugs available. We have many advocacy groups, a lot of therapeutic groups and whatnot that have strengthened care and knowledge, and many people out there are becoming trained, trained so that they can better help our older adults. And then going forward, of course, there's plenty more research. There's plenty more new things that can be done to help our older adults in the future. So that is the end of lesson 7. I hope that you learned a lot. And if you have any questions, please leave comments. And I will see you in the next lesson.